Hello, and welcome to our question of the week. This week's question relates to coding wounds in home health. What documentation do we look at for coding wounds? I know we cannot code directly from the OASIS, and the provider needs to provide the etiology of the wound. But when there is a discrepancy in the wound assessments, the plan of care, and the OASIS, what is a coder to do? This week's question is answered by Robbi James, Director of Coding and OASIS Review here at HPS. The answer is as follows. When coding wounds, as with all coding, always start with the provider documentation. The wound etiology is determined by the provider, that is, the physician, nurse practitioner, or physician assistant as defined by coding guidelines. If the anatomical location documented by the provider doesn't match the clinician's documentation, first, query the clinician to clarify whether it's the same wound or a different one. If it's a different location, query the provider to confirm the etiology for that specific wound. If the clinician documents a different etiology than the provider, unless you've confirmed with the provider that the etiology is different, code according to the provider's documentation. The clinician should then update their notes to match the provider-confirmed etiology. If the provider does not confirm the etiology, clinicians may use clinical judgment to complete the OASIS item. Finally, the wound etiology should be consistent across all documentation, including the OASIS, plan of care, orders, and wound assessment tools. Consistency helps ensure accurate coding and compliance. Do you have a question for our clinical consultants? Join our HPS Alliance. For more information, visit healthcareprovidersolutions.com/HPS Alliance. Remember to like, share, and subscribe to our videos so that you don't miss future questions of the week, Monday Minutes with Melinda, and more.